Hi everyone. Today the topic of my discussion is IUI. I am Dr. Gunjan Bhola. I am working as senior consultant in Gynae department in Asian Hospital. And my topic for today's discussion IUI. IUI is intrauterine insemination. जिनको नहीं समझ आए IUI का बेसिक पर्पस और बेसिक मतलब ये है कि जब इट्स अ फॉर्म ऑफ इनफर्टिलिटी ट्रीटमेंट जब नॉर्मल नेचुरल इंटरकोर्स से कई बार प्रेगनेंसी नहीं हो रही होती तो यू गो टू अ गायनेकोलॉजिस्ट एंड शी इवैल्यूएट्स योर फैक्टर्स एंड देन शी माइट टेल यू कि बिफोर गोइंग फॉर एन IVF कि आप IUI के लिए चले जाएं. सो बेसिकली व्हाट इज IUI? सो IUI इज इंट्रा यूट्राइन इंसेमिनेशन का मतलब है कि वो स्पर्म्स को हस्बैंड से लेके उसको प्रिपेयर करके प्रिपरेशन इन्वॉल्व्स अ क्लीनिंग प्रोसेस. उसमें कुछ फैक्टर्स ऐसे होते हैं, कुछ सेल्स होते हैं जो कि पेशेंट में रिएक्शन शो कर सकते हैं. ऑक्सीडेटिव स्ट्रेस मटेरियल होते हैं, रिएक्टिव ऑक्सीजन स्पीशीज विच कैन एक्चुअली हार्म स्पर्म. उन सबको प्रोसेस करके निकाल के so they make a concentrated pellet and that pellet is introduced into the female's uterus. हम इसमें bypass कर जाते हैं vagina को and सीधे cervix के through we go inside the uterus. वहां से जो sperms है they go to the tubes. जिस साइड की ओवुलेशन होती है उस तरफ की ट्यूब में नॉर्मली तब तक एग आ जाता है and that is the place in fallopian tubes जो ओवुलेशन होने के बाद में फर्टिलाइजेशन वहां होती है. So what is the advantage of then doing an IUI and why IUI is not advised in every patient? जिसको नहीं कंसीव हो रहा हम उसको क्यों नहीं बोलते just go for IUI? There are few criteria which we need to fulfill before an IUI. Because क्या है कि आपको सबको ये काउंसिल कर देगा कि IUI करा लो, IVF से पहले करा लो, IUI is a cost effective option. Yes, it is a cost effective option. So it is, if I'll not say it's the most popular treatment in infertility which is going around, or then I would say that it is one of the popular ones. So why IUI is preferred over IVF? It is preferred over IVF obviously for cost effectiveness, but not every patient is a fit candidate for IVF or for IUI. So we have to calculate कि किस में हम IUI कर सकते हैं. जिसमें अनएक्सप्लेन इनफर्टिलिटी है, पेशेंट के सारे टेस्ट हो गए, हस्बैंड के भी हो गए, देयर हैज बीन नो रीजन व्हिच कैन एक्चुअली बी पिन पॉइंटेड एज कि दिस इज द प्रॉब्लम. देयर इज नो PCOD, देयर इज नो जो हस्बैंड के अंदर बहुत सिवियर वो नहीं है कि स्पर्म काउंट कम है, ट्यूब्स नहीं ब्लॉक्ड है, सो एवरीथिंग सीम्स परफेक्ट but still conceive nahi ho raha. So that is one factor. So we label it as unexplained infertility. Infertility which we cannot actually label it कि इसकी वजह से है. So in these patients we obviously prefer IUI, especially if we give them a trial of 3 consecutive cycles. So what do you exactly mean by 3 consecutive cycles is कि एक के बाद एक. I know our next question can be why do we need to do a consecutive IUI cycles? If it's not working in one, then we can actually drop it off and we can go for an IVF. Yes, you can go for an IVF, but if you have to understand the cost of one IUI is roughly around, I would say 15-20K, even lesser than that also. And in an IVF, one cycle may cost you around 1.5K. So there is a cost issue, especially in our country or other countries where the government or the insurance agencies are not covering infertility treatments. So one option I have told you is the unexplained infertility, in which we prefer IUIs. Second is mild male infertility. So what do you mean by mild male infertility? It's like sperm count जो है वो लेस देन जो है मोर देन 10 मिलियन है, बट ऑब्वियसली देयर इज अ 60 मिलियन जो होता है पर ml which is normally usually seen, but if it is more than 10 million, so there is mild which is affecting. So a question can be कि 10 million बहुत count है, why do we need an IUI when why can it not be done by a normal natural cycle? Yes, it can be done by a natural cycle also, but we have to understand कि जब भी जैसे सपोज कुछ भी नॉर्मल इंटरकोर्स में भी द स्पर्म विच एक्चुअली रीचेस इतने मिलियन स्पर्म्स के बावजूद भी द रीचेस सर्विक्स एंड यूट्रस इज ऑलमोस्ट 1%. उसका सिर्फ 1% जाता है अंदर. उस 1% में से आई वुड से 1 in 14 million एक्चुअली रीचेस द fallopian tubes. So that makes the thing because इसलिए count matters. तो ये एक फैक्टर है मेल फैक्टर में. But how can IUI help to improve my chances of pregnancy? This is what I was discussing. It depends upon, you need to first go to a gynecologist and she has to work on you whether you are a fit candidate for an IUI or you can be straight away taken up for an IVF, or we can just leave you for 6 months or 1 year if all the factors are good, and we can actually leave and we can actually think कि 6 से 8 महीने में if you don't do anything, also just consider on lifestyle measures, you might conceive naturally. And if you're not able to, then obviously IUI is an option. And IUI कैसे improve कर देगा आपके chances? Because obviously आप जब IUI कर रहे हैं तो आप वो जो sperm है उसको आप एक स्टेप आगे पहुंचा रहे हैं. सो जो 1% मैं आपको बोल रही हूँ कि 1% पहुंचा, वो वाला फैक्टर जो सर्विक्स तक क्रॉस होके पहुंच रहा है, वो हमने क्रॉस करके उसको डायरेक्टली यूट्रस में इम्प्लांट कर दिया. तो वो एक फैक्टर है जो करेगा. Can after IUI couple can go for natural try also in the same month? Yeah, you can, but you have to understand the lifespan of a egg is 24 hours, roughly 24 hours. And when we do a planned IUI, usually your doctor will be monitoring your ovulation by ultrasound, and there are tests also like LH surges also if it's a natural cycle. तो उसमें अगर आपको देखकर यू हैव बीन गिवन अ ट्रिगर, HCG का अगर आपको ट्रिगर दिया इंजेक्शन, तो जो आपका ओवुलेशन टाइम है, यूजुअली वी प्लान एन IUI अराउंड 24 to 40 आवर्स के अंदर अंदर वी प्लान एन IUI, क्योंकि दैट इज द टाइम जब एग रिलीज होने के चांसेस हैं. सो या यू कैन गो फॉर नेचुरल ऑल्सो, बट ऑलरेडी एग रिलीज हो चुका है, तो कितना बेनिफिशियल होगा, दैट इज something tricky also. When is the best timing of insemination in an IUI cycle? What is the optimal method of timing in natural or stimulated IUI cycles? So the best timing, as I was discussed earlier in the last question, the best timing of insemination is obviously if it's a stimulated cycle, we have stimulated enough. So जैसे ही 18 mm से plus का follicle दिखता है, तो usually your gynecologist might give you some trigger in the form of HCG. और वो ट्रिगर के बाद में 24 to 40 आवर्स में यू शुड गेट योर IUI डन. एंड इट्स बेटर टू गो फॉर सिंगल IUI which is the preferred, though there have been studies के 2 बार IUI कराएं, which obviously increases the cost of the procedure also for the patient. So it is not that cost effective as been seen with other trials also. So in a natural cycle we go for an LH surge and उसको measure करते हैं. LH kits आती हैं जिससे पता चल जाता है. Then they can have an IUI जब LH surge हो जाए उसमें. So ये उस factors पे depend करता है. How can IUI? I think I have already answered that question. So let's move on to the next thing. Before going for IUI, one should go for IUI. It can be a preferred modality, but then if patients both tubes are blocked, or if she has endometriosis which is of moderate to severe variety, or there is a male factor where the sperm count is quite low, more than 3 million. So in that cases I would say she should go directly for an IVF rather than going for an IUI cycle, because it will be just wasting the time and money. So it is better in that cases. But in other cases, IUI is a very cost-effective option, and it has been there almost since more than 100 years. We have been dealing with IUI now. So though the quality has obviously improved because there are factors which has helped us. We are closely monitoring it, and by ovulation, it is important by ultrasound, because sometimes when you ovulate the patients by giving them ovulation stimulation protocols, जो कि इंजेक्शंस के फॉर्म में हो सकते हैं, टेबलेट्स के फॉर्म में हो सकते हैं, उससे कई बार एग ज्यादा बन जाते हैं. जब एग ज्यादा बनते हैं, ऑब्वियसली मल्टी फॉलिकुलर ग्रोथ इंक्रीजेस द चांसेस ऑफ कंसेप्शन. बट ऑन द अदर हैंड मल्टीपल फॉलिकुलर ग्रोथ से There are chances of multiple pregnancies, twins, triplets, which becomes later on can be a burden for the patient also and will become a difficult pregnancy also. Plus sometimes वो ज़्यादा stimulate हो जाती है ovary and there is a rare but yeah it is a life threatening condition also which is known as OHSS, which is known as ovarian hyperstimulation syndrome. So your doctor need to closely monitor your ovulation patterns and she should be sure of कि जब वो ovulation में देख रहे हैं तो कितने eggs बन रहे हैं during your ovulation study. If there are more than 2 follicles of 15 mm, she should think of either cancellation of that cycle और या फिर मोर देन 5 है जो कि 10 mm से ज्यादा के फॉलिकल्स बन रहे हैं उसमें जो लेटर ऑन इतने फॉलिकल्स में रिलीज हो जाएगा तो वो मदर के लिए भी रिस्की कंडीशन हो सकती है. मदर को उसके बाद में पेट में पानी आ सकता है, एसाइटिस हो सकता है, इवन रीनल शटडाउन कैन आल्सो अकर एंड काफी पेनफुल हो जाती है, काफी इनलार्ज्ड ओवरीज हो जाती हैं. यूजुअली नॉट सीन मच विद एन आईयूआई बिकॉज आप इतने ज्यादा ड्रग्स नहीं देते हो एक आईयूआई वाले पेशेंट के लिए, बट कैन बी सीन इन एन आईयूआई आल्सो दो क्वाइट रेयर, बट हो सकता है. आईवीएफ वालों में ये ज्यादा देखने को मिलता है. सो आईयूआई में व्हाट एक्चुअली मैटर्स, एज ऑफ द पेशेंट. या एज ऑफ द पेशेंट इज लाइक यूजुअली आपने सुना होगा कि फीमेल की एज ज्यादा हो जाती है तो ओवुलेशन एग क्वालिटी उसकी डाउन हो जाती है. या इट अफेक्ट्स एग क्वालिटी डेफिनेटली. So under 40 years, IUI should be recommended. More than 40 years, they should be counseled for other options also. And similarly, the next question is कि male की age does it matter? Male की age matters because male में अगर male और female दोनों की age ज़्यादा है, a female is more than 35 and male is also 40, then obviously it's a synergistic bad effect. Synergistic bad effect में मतलब egg quality में भी है, स्पर्म में भी डीएनए डैमेज ज्यादा हो सकते हैं. देयर कैन बी क्रोमोसोमल एबनॉर्मलिटीज इन द फीटस जो हो उसमें जेनेटिकली ट्रांसमिट हो सकती है ड्यू टू मेल के डीएनए फ्रेगमेंटेशन जो होते हैं उनके सबकी वजह से. अब आईयूआई का प्रोसीजर इट्स क्वाइट सिंपल. इट्स नॉट कि आपको कहीं बेड रेस्ट करके बहुत देर तक रहना है, आपको उसके बाद में बहुत सारे प्रिकॉशंस रखने हैं. इट इज काइंड ऑफ डे केयर प्रोसीजर. आप डे केयर भी नहीं है, आप अपने डॉक्टर के साथ में मेडिसिन ले रहे हैं, वो आपका ओवुलेशन मॉनिटर कर रही हैं. यू बीन प्लान फॉर एन आईयूआई, आपका आईयूआई हुआ, शी विल रिक्वेस्ट यू कि 10 से 15 मिनट आप वहीं पे रेस्ट करें एंड उसके बाद में यू आर गुड टू गो होम. सो आईयूआई डज नॉट हैम्पर विद द इकोनॉमिक क्राइटेरिया ऑफ द पेशेंट ऑल्सो. उसको बहुत छुट्टियां नहीं लेनी पड़ती. सो दिस इज व्हाट एक्चुअली इज इन आईयूआई if stages. I can explain you, as I've already explained you. Stage 1 is ovarian stimulation. You will be given medicines or you will be given injections to stimulate your ovaries ताकि eggs जो हैं एक की जगह अगर multiple बन जाए तो अच्छा है multi follicular के लिए. And definitely it affects ovulation tracking also. So you have to track the ovulation also by ultrasound or by other means. And stage 3 is semen collection. Yeah. So husband's semen is collected and usually the husband is advised कि उससे पहले at least 3 to 5 days they should not have relations. Why they should not have relations? Because it affects the quality of the sperm at that time. So after collection of sperms, the semen, it is processed, it is washed. There are 3 methods in which semen washing can be done. It's a simple wash also, swim up method or double gradient. All are equally effective. And stage 5 is insemination. And obviously insemination is once it is prepared, it is instilled through a catheter. It is IUI catheter into the through a woman's vagina into her cervix into her uterus. So after insemination, after 14 days of her insemination, she is tested for pregnancy. We can get a beta HCG done to see whether she is conceived or not. So this will help us to monitor it better. Other things which are important in IUI which need to be taken care of are, as I've already mentioned, bed rest is important. There have been hypotheses like usually, as I've already mentioned, only 1% actually reaches cervical canal. Why? Because even after a natural intercourse, if a woman gets up, the semen has to come out, so only 1% is left. So the hypothesis says कि अगर वो 10 से 15 मिनट तक रुकती है तो वो वाले जो sperms हैं, it takes 10 to 15 minutes of time for the sperms to reach the fallopian tube, so it helps in that way. अदर थिंग्स विच वी कैन थिंक ऑफ, आपकी पहले बोलते थे कि एंडोमेट्रियल लाइनिंग जो है वो बहुत इंपॉर्टेंट है. एंडोमेट्रियल लाइनिंग इज इम्पॉर्टेंट, बट उसका इतना ज़्यादा अभी नहीं, मतलब देयर हैव नॉट बीन अ कॉन्क्रीट रोल विच वी कैन एक्चुअली थिंक ऑफ कि हाँ ये है. सो इन पेशेंट्स जिनके अंदर कोई फैक्टर नहीं है, अनएक्सप्लेन इनफर्टिलिटी है, या जिनके अंदर स्पर्म काउंट मोर देन 10 मिलियन आ रहा है, they are very good candidates for going for IUI in 3 consecutive cycles. Maximum cycles, there has been no for that, so we cannot actually say कि इसके बाद नहीं करना है. There have been successes with 6 IUI also and even 9 also, but then that is something the patient also has to decide, because IVF will also be expensive for that patient. So that is also one thing the patient has to think. IVF has more awareness as compared to IUI. Why is it so? Is the reason is this: by the time you reach a stage for an IVF, your time for IUI has most likely gone, because you are not aware of. There is a taboo in our country. People who have gone to an IVF specialist, they have kids with an IVF treatment, they will not tell their friends or their near ones it's an IVF conception. So सब अपने आप से इधर उधर से ढूंढ के पहुंच रहे हैं. IUI को से पहले को ट्राई करना ही नहीं चाह रहा, क्योंकि most of the time usually with the kind of lifestyle we have a very lifestyle. So yeah, it's very important that females are goal oriented and they are independent enough, but then we don't have the fertility reserve like the western counterparts. जो western females हैं उनमें 40 years में भी बहुत अच्छा fertility rate है, not as compared to our Asian I would say genes. So that is also one thing. तो जब तक आप उस स्टेज पे पहुंचते हैं, आपकी egg quality भी खत्म हो गई, आपके egg count भी कम हो गए, so you are left only with IVF. Obviously you become के like अब तो मुझे 7-8 साल हो गए शादी को and अभी तक आपने नहीं सोचा, and now it's like अब तो मुझे करना है. So either people don't have time or they have already tried everything and they don't want to go for an IUI and now they want IVF. So it's more like a pizza delivery कि अब करना है तो अभी करना है बस फटाफट. Do we do IVF and out both, and where is your center? I am not doing IVF right now, but yeah, I am doing IUI in my center, and my center is in Sujeevan Clinic. It's in Sector 21C, Main Market. The address is available downstairs, and you can actually find a consultation number also, so you can contact me there and can book an appointment there. What is the cost of R at your center? So the cost is it's an interesting thing. I've already mentioned, and IUI is usually ranges between, because we have to see in which criteria you actually fall, because you will require a close monitoring of ovulation or not, because ovulation protocols are also included in it, the ultrasound ones. So usually the cost of IUI is around, I would say 10 to 15K. So that's the reason it's quite cost effective as compared to that. And I think I have covered all the important points of IUI and the myths related with IUI also. उसके बाद कोई बेड रेस्ट ऐसा नहीं चाहिए, कुछ ऐसा नहीं है कि आप ये एक्टिविटी नहीं करें, यू नीड टू टेक फर्दर मोर रेस्ट और एनीथिंग. सो फॉर आई फील जितना रिलैक्स्ड और जितना कंफर्टेबल आप रहेंगे, उतना the chances of fertility are increasing and will help you, because anxious or negative thoughts even has a way of leading to negative hormones, जो कोई भी ट्रीटमेंट आपका कवर अप नहीं कर पाएगा. So it's very important that go with a positive mind and just think it as a normal process कि आप अपना कराने आ रहे हैं. Don't take it otherwise कि अभी तो हमने सब कुछ किया था, क्यों नहीं हुआ, conceive क्यों नहीं हुआ. You have to remember the success rate of even an IVF is around 50%. What all tests are involved in process? Any blood test or any other test? Yes, blood tests are involved of both the partners. I think it's important कि उनसे पहले उनके सारे viral markers का वर्कअप होना ज़रूरी है. ये देखना पड़ेगा कि बेसिक हीमोग्लोबिन कितना है, थायराइड टेस्ट कराने होंगे and some other hormonal tests are required before any treatment is started. And viral markers में दोनों husband and wife का जो viral वाले HIV, HbSAg, VDRL ये सारे टेस्ट हमें कराने हैं ताकि they should not be transmitted to any of the partners. IUI also actually I wanted to discuss one more aspect of IUI. I think I just slipped out of my mind is donor insemination. So donor insemination is also something, and आजकल की जितनी independent females हैं और वो हैं it is gaining popularity. Initially donor insemination किस में किया जाता था? जहाँ पे male का sperm count is absolutely zero. And they don't want to do anything else about that. And या फिर there is a family hereditary condition in male side of family which is Y chromosome linked, जो invariably बच्चे में transfer होगी. तो उन cases में पहले donor insemination किया जाता था. But right now with the kind of independent and competitive females who have their individuality, and they are also going for donor insemination. So it is also gaining quite popularity these days. But then you have to get it from a good lab. The donor sample, it is thawed, and obviously that sample is screened for all the viral markers. So this is also a good way of getting a conception if there is other problems. But सबसे important ये है, you should be aware of this and you should stop the taboo with all the infertility treatment. It's quite normal. And you might not be available, or you would not be aware of the fact that people around you कितने सारे आपके आसपास होंगे जिन्होंने कोई ना कोई infertility treatment लिया होगा. So I think it's better to share your stories with them if you have done with your other friends, so that you might help them in this process. They should not reach the doctor that late कि IVF के लिए भी उनको बोला जाए कि आपके eggs की जगह पे हमें दूसरे eggs लेने पड़ेंगे because your egg count is so low. Thank you so much.